Hello friends, so today I wanted to share with all of you what I carry in my work caddy. So I happen to be a registered nurse and I work at an OBGYN outpatient clinic. We are part of a hospital, so that means that we're part of that hospital team, but I am generally at an outpatient clinic. However, sometimes I get moved around. I do have a specialty, so I do have an office. That's because I have this specialty, there's only me to do that job. However, when I don't have patients, sometimes I will be sent over to another location, or most of the time I'll stay within the clinic, but I'll go to the area where all the other nurses are at, and they have desks, and so I'm sitting in a place that's really not my usual spot. It's not really my desk. And so this was the solution that I found. And actually, this work caddy that I have here, let me tell you the brand. I think it's called 31. Yeah, it's the 31 Deluxe Double Duty Caddy. This one I just packed up. So this isn't the one that I've been using for the last 5 years. For the last 5 years, I've been using this other caddy, and I already packed it up with something else. So I'm gonna use it right now as our caddy with all of our first aid stuff. So you can see there, it's a bit smaller, and this caddy is from a brand called Everything Mary. So you can see the size difference. It's pretty significant. But this caddy has been great. I have loved using this caddy. The only thing about this caddy that wasn't totally working out was that my binder didn't fit inside. So what did I do with my purple binder? I don't see it here, but you'll see there's a different binder. This is a brand new binder. I decided to go ahead and replace my binder, but I had a binder the same size, and you can see it doesn't slide into this caddy. So basically, when I was moving around desks, I would be carrying my binder in my hand, and then I'd be carrying my caddy, which again, it's been working out great. I just decided to get something new, and I wanted to try something that actually fit the binder. So I found this caddy from 31, and I think it's gonna work out. We'll see. I'm hoping for the best. I do notice right off the bat, just a few details. Something that I really liked about this caddy from Everything Mary. You can find these on Walmart.com, by the way. That's where I got mine. So it does have this flaw, but it didn't really bother me. And it was like this since the beginning, like basically brand new. This would slide around, but again, it didn't really bother me. This handle, I do really like how sturdy it is. I don't know if it's metal or not. It doesn't sound like it, but it's a hard tube here. And I just thought that provided some nice stability. And this isn't. This is pretty flimsy right here. So again, we'll see how long that lasts. And then the other thing is that the bottom of this is also pretty nice and stiff, and so are the sides. But this is like super collapsible. So again, I'm not sure how well this will hold up, but this one has held up really great. In fact, you can see I'm repurposing it, and it's going to be perfect for my at-home first aid kit. And if you guys would like to know what a nurse who's a mother, who has a husband that works, you know, with his hands, he is an automotive technician on diesel buses, so he's always getting scraped up. If you want to know what kind of things I carry in my first aid kit, I would love to share that with you. Just let me know, and we can do something like that. But yes, this work caddy has been great. I totally recommend it for a nurse who's in a similar situation as mine. However, we've moved on. Now we're using this 31 caddy, and I'm going to share with you what I have inside. So every nurse's situation is going to be a little bit different as to what they need. in their Caddy. A lot of nurses who work on the floor might have different things than I do. I will sometimes work on a nursing floor if there's a shortage and I don't have patients scheduled, or they'll block my schedule and I'll go to a floor. Like during COVID, that was something that was sometimes done because there was the need for coverage. But generally, that's not the case. If I was being sent to a floor, I probably wouldn't take this with me. This is really something that I only keep in my area that I'm at, which, like I said, it's in an outpatient clinic and it's an OBGYN clinic. So the things that are in here are going to be specific for me and my situation. However, I do think that a Caddy like this one would be a wonderful asset for a nurse that works on a floor, because something like this you can keep in your locker and you can carry your essentials. For example, one of the issues that we have at our hospital is that, just as an example, I need a lot of lotion. I am washing my hands constantly, all day, every day, but we're not allowed to keep lotion at our desks, because if we keep it at our desk and they come in and do inspections, then they'll be like, well, why are you administering this lotion to the patients? And even if we say that it's ours, the fact that it's there in the room, in the desk, is a no-no. So, however, when you keep something in your own personal bag, they really don't go through your own personal stuff. It's only the stuff that's in the patient area that's being looked through. So I do think something like this would be good. And then what I do with mine before I leave, at the end of the day, I have a safe location that I can leave it at. And a lot of times, you know, you can lock it up in a safe spot. And if you're on a floor, then you have lockers that you can use to keep your stuff locked up. So the things that these are things that basically were transferred from the other Caddy onto here. However, I did buy some new stuff just because, like I said, I've been using the other Caddy for about 4 years. So basically I've been looking at these things every time I go into work for 4 years, and I wanted to get a few new things. So I got a new binder and I got something that I just thought would make me happy to look at. These are Squishmallows. And this binder isn't something that I ever pull out in front of a patient. This is for my own personal notes. So if there are refresh protocols, or if there's just patient information that I am needing to access all the time, then I'll keep it in here, and before I go see a patient, then I can just pull it out from one of these sheets. So you can see, like I said, I just moved into it, so it's actually empty. I have all of my stuff sitting over here on the side in a pile, and I am gonna put in all of my documents in here. And I bought new tabs so that these are January through December tabs. I really won't need that. I bought new tabs so that I can label them however I want, and then put the information that I want in here. But basically, it's like a quick reference for me, because sometimes, even though you have access to everything that you need online, it's just faster if you have it in a binder, especially if it's something that you use all the time. I never am overly confident about anything. So, for example, if there's ever something, I'm giving a patient information, I always want to make sure that I'm being accurate, that I'm looking at the reference, and it's hard, even though I may have dealt with this sort of issue, 50 times, it doesn't matter. I want to make sure that I'm giving the right information, so it's hard to go online and look at everything again. Maybe it's a policy or a procedure protocol. So if you just have it here, I can take a quick peek, make sure that I'm not forgetting anything, so that I can give the patients all of the information that they need about whatever is going on. So that's why I have a personal binder that I keep. I also have like phone numbers in here for quick access of all of the people that I generally call. And then just other quick patient reference information. Sometimes they need referrals or they need advice on where to go for a certain problem. So then I keep these things here. I have lists and I can easily give them the information without just trying to recall it from memory. And if I need to, I can make a copy of that information and hand it over to them, and I can just grab it quickly from this binder. And of course, if something changes, I can take that paper out and replace it. So I still stay accurate for my patients. So yeah, so I really do like having a binder, but again, that's a personal thing. Some nurses will just have like notebooks and they'll keep notes, and that's fine too. A binder has worked for me for a lot of years. I've been a nurse since I was about 22 years old when I graduated. I'm now like 36. So I've been a nurse for a while, and most of my nursing career has been in OBGYN. And at this point, I do have a specialty. I am a urodynamicist. I've been doing that for like 9 or 10 years at this point, and that's my full-time, that's my primary job. However, because I'm located within an OBGYN clinic, I do still have to deal with a lot of the other that other patient population. So I don't just deal with pelvic organ prolapses and urinary incontinence, but I also deal with high risk obstetrics patients and then healthy OBGYN patients and just, you know, other things, STDs, you know, the list goes on and on. There's so much, but I love my job. I love my job. So yeah, that's just a little bit about my history. I also have a calendar, and this calendar, what is this? This is the Happy Planner. I think I got mine online, but I've also seen them at Walmart, and I just use this to make sure that if I have meetings or something, that I write everything down. We usually have weekly meetings, so then this is a good place to keep notes, to keep track of things. And I have a big planner just because it's cute and it gives me a lot of space to write. But that's really not necessary. You can have a little planner. So yeah. And then in this pocket, I also have a notebook, and this is a brand new notebook. I just bought it. I don't use these notebooks a lot, to be honest. Mostly if I have something that needs to be written down and just needs a little bit of attention, I'll stick it in my planner. If it's something permanent or something that's long-term, it goes in my binder. And then these notes are like a special occasion thing. So like I said, I just replaced this. This is actually the one that I've been using for years and years and years. And you can see, I'm going to tell you like how far it's written into. This far. And I would say that this notebook, I've been using it for more than 5 years. Like seriously, more than 5 years. I've been using it for a really long time. In fact, as I'm looking at the first couple of pages here, it's probably been like 8 years. Yeah, okay, there's a date, 2013. So it's been a while that I've been using this this notebook, and like I said, I really don't use it a whole lot. I'm going to see if there's anything like very important information here that I need to just jot down over here before throwing this out. But I just thought it was time to replace it, and this notebook has been great. It's super sturdy. I think I got this at Barnes & Noble's. It's from Right Ideas by C.R. Gibson. But Barnes & Noble's has a bunch of really nice, sturdy, good notebooks. And I know that it might seem silly to keep notes for that long, but I am telling you, I will pull out this notebook at least once a month, and I'll be like, what is that calculation? What is that formula, you know, to determine whatever? That's where I write stuff like that here. So like if there is a mathematical equation that I need to get done to determine if a bladder is doing the right things, you know, I don't always remember those by memory, and generally the computer generates all of that information for me, but I need to make sure that I know how to determine if the computer is doing it right. So sometimes I have to do the math myself, and so those are the types of things that I write down in here. I sometimes also, if a provider is giving a patient methotrexate, there is a calculation. Even though the provider already told me how much they want me to administer, again, I need to make sure that it's the right dose for the weight of the patient, and those types of formulas are in here. So those types of things I am going to be transferring over to my new notebook just to make sure that it's there for when I need it. But it was just time to replace this one. And yeah, so those are some special notes that I keep. Okay, so other things that I have in here. So those are basically the two main compartments. It's just my binder, my planner, and a notebook. And then this is my badge reel. I did make this myself. I had like a resin mold, and the glitter is from Michael's, and the sticker, I think this sticker I got from Walmart, and then the badge reel I got from Amazon. And so I poured it and I made it, and it's super cute. Yeah, so that's my badge reel that I have right now. I love it. It's so cute. I love glitter. Okay. In this pocket, some personal items. I have lotion. Again, I use lotion a lot, all the time, and your hands get really sensitive from washing your hands a lot. And then I also do have a little bit of eczema on a few of my fingers, so I just have to make sure that I'm staying moisturized, that I'm using a good skin protectant, and Cetaphil is always, you know, perfect. Chapstick. I have a little mirror. Nail polish remover. I do like to wear nail polish, but you're not really supposed to wear nail polish at work, so I have some nail polish remover in case I forgot. I also really like to use nail stickers because those are easy to peel off. So that's another tip. And then I have a few extra little lotions because I like to keep lotion in my pocket in my scrubs. So I have like a bunch of these here at the house. I bought a bundle of them. I don't think people are supposed to be selling these because it says that they're not for sale, but these are like the perfect size to carry in your scrubs. So I bought a box from somebody and I use those, and they're fragrance free, so they're perfect. And then I have this calmoseptine ointment. This ointment I got at a nursing conference. They were giving them out as samples, and it's supposed to be a skin protectant. At the conference, they were giving them out because they're supposed to be a barrier for the purpose there at that conference was to help patients that have urinary incontinence, and this helps to protect their skin. It's a skin protectant. It is mentholy, so I don't know if that would be the preference for patients. A lot of times I just tell patients to use Vaseline or A&D ointment. But this is actually really nice. So like I said, I got this as a sample. They gave me a handful of them, and I use it whenever my eczema flares up on my fingers. I will use a little bit of it to protect my hands, and I do like it. So I don't know if it's something that you would like to try. Like I said, generally for patients, if I'm giving advice, it's just Vaseline or A&D ointment, something like this. It's a little bit thick, so even though I haven't had any problems, but you can see how thick that is. It's almost like the stuff they use for babies for a diaper rash. The problem with those is the removal process. So some patients will want to make sure that they're removing it completely. So instead of just letting that ointment sit on the skin, they'll like scrub at that to make sure it comes off, and then want to replace it after they cleanse the skin. But the point is to not do that, to go ahead and just you know, this is going to prevent moisture from touching the skin. So if you're trying to wash it off, it's not going to come off easily. So you want to just leave the ointment, just let the water run over it, even if it's soapy water, and then just pat dry. You don't want to really be rubbing at the area. Anyway, I'm going on a tangent. But yeah, this is why I have this, and I do like it, and I use it, as I said. And then these are some notepads. Again, I replaced the ones that I had with some new ones, and so I just put some sticky pads in here. And then this is one that I had at home, and I thought it was really cute, and I'm going to use it. These sort of little papers and notepads get used up really quickly at work, just from, you know, you speak to a patient, you make a note, and then it goes in the sharding. So papers like those get used up really quickly. I have a few stickers here, and the reason that I have stickers is just, you know, customer service, I guess. So if I'm sending a letter to a patient to their house, whatever it is, I don't know, I'm trying to think of a reason why I would send a letter. Maybe they requested something. They wanted a letter for their employer or something. Sometimes on a little sticky paper, I'll just write, here you go, here's what you requested, have a nice day, and then I'll put a sticker. And it's just, you know, giving them a moment to be happy, and, you know, whatever it is that they requested, let them know that we're just, you know, we're thinking about them, and we're hoping that their pregnancy or whatever it is that they're going through, that everything is going well. And this one, I don't really know if I'm going to need this at work, but I decided to stick it in here. I bought new scissors for my Caddy, and it came with it. So I have the scissors over here on the side. I do use scissors, and again, there's scissors around the clinic and around the hospital, but it's just nice sometimes to have your own. I have a little stapler, an eraser, pens, generally pens. I have a few pens that I really like, but I will always have a ton of pens. In fact, I have more pens over on this side and highlighters, because somebody might ask you for a pen, or, you know, whatever. you always need a pen at work. But the ones that I really like, in case that's something that you're interested in, I really love these ones, the Uniball Air, and you can see the tip. These are really good. I love these at work. And then of course you always need a Sharpie. I dropped it. I have another one in here, but I'll stick that one in there. You always need a Sharpie to label IV bags or whatever. And then this pen is also really good. This is the Big Gelosity. I also like this at work. But I need to find these. I haven't seen them at Walmart, so I'm not sure where to find them, but I need to get some more of those. That's like my favorite pen. And then back here, this Caddy, you can see it's really nice and roomy. Back here, there's just the tabs that I said I bought that I'm going to use, and I have my stethoscope and my blood pressure cuff. I want to get, this is like a regular size blood pressure cuff. I want to get another one, a large one. And that's really basically everything that I need. Like I said, I just bought this Caddy, and you can see I put some new things in here. So a lot of my actual documents, I'm gonna move them over now. And another thing that I've been keeping in my Everything Married Caddy, and this is just something that sometimes I like to use for reference. I work with a lot of physicians. I've been working with them for a long time. So if I ever have any questions, I'm free to ask them, and they're very frank with me, and they tell me any information that I want to know. And then I'm always doing research. I stay up to date. I have some nursing organizations that I pay membership to, so Again, I make sure that I'm staying up to date, but I really enjoyed this book, so I'm gonna go ahead and tell you what it is. If you have children, I don't know, you might wanna push them out of the room, but I think that this is a great book. I think it's a book that honestly all women should read. I've been tempted to go ahead and buy my mom a copy, or maybe just give her my copy and have her read it, because it's really good. It's called The Vagina Bible by Jen Guntner. I've read this book twice, and then I also will occasionally pull it for reference. And again, I'm not lacking in references. The hospital provides us with lots of references, everything that we need. But the difference with those references and with something like this is that this is written in a way that it's easier to understand. So for example, I might be reading something medical, and it might be hard for me to put it in words or in terms that are easy for a 13 or 14-year-old to understand, and I'm trying to get to them and explain to them why they need to use condoms, for example, or why this problem that they're having, how can they prevent future problems. So anyway, so things like that, you have to be able to talk to people in a way that you're going to reach them. Sometimes you're speaking to someone who's educated, sometimes you're speaking to a 12 or 13-year-old who's pregnant. And so anyway, that's why I like, as a nurse, to read a lot. And this isn't the only book that I've read on topics like this, but it kind of helps me to expand my mind to know what kind of terms are used now for different body parts. I have to be able to understand them, and I want them to understand me, and I want to reach their heart so that they can be as safe as possible with whatever it is that they're doing, because that's my job. It's my job to, whatever lifestyle they have, how can I help you be safe in that lifestyle? You know? So that's why I like books like these, and I just thought this book was great. I totally recommend it. Like I said, I have, even the physicians that I work for, I tell them, hey, this book is wonderful, read it. So it's really, really good. So this may be something that also goes in the Caddy. I haven't decided that yet. It's been in there for a while, and I feel like I haven't reached for it in the last couple of months. Maybe I've maxed out on it. Maybe the things that, initially I was excited about, to use words like that or to explain something, maybe I've already, referenced it enough. So it might not be going back in there, but I've really enjoyed it. I've really enjoyed having it in the Caddy. So yeah, so I'm trying to think if there's anything else that, anything else to say about it. I really can't think of anything else right now. These are basically the things that I have in here, and of course, the important stuff is like, this is just the fluff, right? But the important stuff is what's actually the forms, the things that are actually useful to me. However, having a nice place to put them, a nice planner, something that looks pretty, it just brightens up your day a little bit, really. And so that's why I wanted to share it with all of you. And I hope this helps some of you. If you have any questions, I would be happy to answer them. And yeah, I think it's gonna work out. We'll see. It's a little bit bigger than the other one that I had. The other one was, the size was nice, but like I said, it wasn't fitting my binder, so that's why I decided to switch it out. And hopefully this one's not too cumbersome or too big. I don't think so though. I think it'll be great. All right, friends. Well, thank you so much for watching, and have a good rest of your day. Thank you. Bye-bye.